Are you ready to bear it all? Welcome to tonight's event, our virtual event around how you can achieve your dream body this year. Whether you're looking to lose weight with the injectable weight loss that everyone's been talking about, get rid of stubborn fat, or tighten that loose skin, we are here to answer all your questions. And for being here, you all get $50 added to your account to use for any service. And also you get added to our great giveaways. We're gonna be giving away 4 cycles of CoolSculpt, a body transform from elastin, and 10 B12 shots. Stick around, and don't forget you'll be able to ask live questions to myself and our providers. You've heard it in the headliners, maybe your best friend or neighbors are on it, and most recently you've heard Oprah talk about this incredible injectable weight loss that's helping thousands of people lose weight and feel confident and healthy. Tonight we're going to talk about semaglutide, what it is, how it works, and how people qualify. So if you're somebody who is looking to lose 10 pounds or more, this is a treatment that you want to listen to.
Hi, I'm Nicolette. I'm a board-certified family nurse practitioner. I work at Images Med Spa, specifically in the Mokina location. Semaglutide was first being used in diabetic patients. It was causing a pretty significant amount of weight loss, so it was approved as a weight loss supplement. What it does is it works on the GLP-1 receptor. After you eat, it increases your insulin secretion. It also delays gastric emptying, meaning that you feel fuller for longer, working as an appetite suppressant as well. So the goal with semaglutide is to lose 1 to 2 pounds of weight a week. Some patients don't start losing until week 3 or 4. Some patients start losing right off the bat. The ideal candidate for semaglutide is somebody that has an elevated BMI and has already been trying to lose weight, is on a healthy eating plan, a good exercise program that they maintain, and they're just having trouble losing those extra pounds. Semaglutide is administered as a once-weekly injection, either in the abdomen, the back of the arm, thighs, etc. Semaglutide works on one receptor, whereas you get a little bit more from tirzepatide, working to control blood sugar a little bit extra within the body. The big thing is starting them off on semaglutide first to see how things go, and then if we get to those max doses, if they're not losing anymore, if they're experiencing negative side effects, then that's when we would talk to them about transitioning over to tirzepatide. Typically, you see results right away for some patients. Some patients, again, don't start losing until week 3 or 4. The 2 most common that I see and that I have patients report are constipation and abdominal bloating. Some other GI-related ones are nausea, vomiting, diarrhea, as well as indigestion. There's also the potential risk for injection site reaction. Potential rare ones, and again, these are rare, but they have come up in studies: acute kidney injury, pancreatitis, fainting spells or syncopal episodes, and thyroid nodules, thyroid masses. When people start losing weight, they have that little boost of confidence. They feel good. So when you feel good, you choose to do healthier things. You choose healthy eating habits. You choose to exercise a little bit more. It's about living that healthy lifestyle. The cost of semaglutide every time we order the medication is $800. If you stop taking semaglutide, you may gain some weight back. Or for example, I have a patient that we weaned down off of the medication. She's gained about 5 pounds back, but she said to me she's lost 60 pounds, so 5 pounds isn't, bad for her. Yes and no. I mean, will you gain some weight back? Yes. Typically, you'll be on the medication for X amount of weeks. When they are around their goal weight, I will typically leave patients on their dosage for about 6 to 8 weeks, and then we will start to wean down. Research shows that 6 to 8 weeks of continuous good behavior, good habits, portion control, exercise, nutrition, that will continue to help maintain their weight loss. The lab work needed is a CBC, so a complete blood count, a CMP, which is a comprehensive metabolic panel, a TSH, which is a thyroid stimulating hormone, and then amylase and lipase are preferred, but sometimes can be deferred. If you've had labs done within the last 6 months, you can bring those results in, or we can always order those for you. Booking a consult, it's pretty much as easy as that. And then your provider can go over next steps. We will get a little bit more of an in-depth history because there are some contraindications and BMI that you are required to meet to qualify for the medication. Typically, you'll come in once a medication is received and your provider will go over injection teaching with you. You'll do your first injection with the provider walking you through the injection, and then you can do those once weekly injections yourself. Or if you're just a patient that is not comfortable with injecting yourself, you can most definitely come in for your weekly injections with your provider. Booking a consult, if you are a patient that qualifies, maybe you don't have a lot of weight to lose or your goal per se isn't weight loss, then we may adjust your dosage and only keep you on the medication for a short period of time, teaching you about portion control and helping you build good habits on nutrition and exercise that it helps with too. Everybody's a little bit different as far as plan goes. So for example, I specifically will keep you on that dose for about 6 to 8 weeks because again, research shows 6 to 8 weeks of good portion control, good eating habits, exercise habits, etc. help you maintain that discipline and those good habits to help carry you through. Once that point comes where you are ready to come off of the medication, you should wean down. There is always an option to stay on a maintenance dose too if you feel more comfortable with doing that. I have patients come in and they say, well, I just want to lose this little bit. CoolSculpting and M-sculpting are great for treating specific areas. Other injectables could be Kybella PCDC, as well as Sculptra or Hypergilute Radiesse to kind of restore some of that collagen. Radiofrequency microneedling is great for tightening and toning specific areas. The options are really endless.
So now if weight loss isn't really what you're looking for to achieve your dream body, you are already eating healthy, you're active, you're doing all the right steps, but you have those bulges of stubborn fat that you cannot get rid of, CoolSculpting is something that you might be interested in. Check it out.
My name is Lacey. I am an esthetician at the Deer Park location. I've been at Images for a little over 2 years. CoolSculpting is a non-invasive, FDA-approved treatment that focuses on stubborn areas of fat and reduces fat cells about 20 to 25% each treatment. CoolSculpting reduces fat by targeting your area of concern and then frees the fat. The results are shown at 3 months. Someone who's on their journey with diet and exercising, anyone who has pinchable fat. We say if you can pinch an inch, you can be treated. That is an ideal client. With CoolSculpting, you're not necessarily losing any weight. Technically, you might lose inches, so your jeans are gonna button better, but nothing changes with the scale. Well, you can treat under the chin, bra fat, arms, upper, lower abdomen, your love handles, for legs, outer, inner thighs. You would do your first treatment and then come 4 to 6 weeks later for your second. And then it's also patient depending on your desired goal. CoolSculpting, we always stick with the golden rule of 2 full treatments to see full results. CoolSculpting is a permanent solution to get rid of those stubborn fat cells in that desired area. CoolSculpting actually is very comfortable. Most patients pull out their laptop at work, watch Netflix. The only time the treatment can be a little uncomfortable is when I take off the applicator at the end and do a 2-minute deep massage. It's the most crucial part of the treatment. It increases effectiveness by 65%. With diet and exercise, another way to keep your results would be scalp treatments after. Each cycle is $675. We are running a special 8 cycles for $3,200.
Now, if you're somebody who is already at their weight goal and doesn't have any stubborn fat, but you're looking to tighten that loose skin caused either by losing a lot of weight or postpartum, radiofrequency microneedling is a solution for you. So check it out.
Hi, my name is Gia Cordaro. I have been a licensed esthetician going on 25 years, and I work at Images Med Spa as the Director of Aesthetics. Radiofrequency microneedling is a skin rejuvenation treatment that will help tighten the skin along with skin rejuvenation. Loose skin forms on the body in many different ways, just the natural aging process, the lack of collagen production and elasticity, weight loss, pregnancy, and other aging factors. What it's doing is it's taking the radiofrequency and it's taking the loose skin and it's helping to shrink wrap it underneath, causing a tightening effect. 4 to 6 treatments is recommended every 4 to 6 weeks apart.
No matter what your body dream goal is, Images Med Spa is here to bear it all with you. So stick around as we open up the live Q&A so you can ask questions about any of the treatments we just presented to you to our providers. See you soon.